Good evening, and welcome to tonight's CardioCore Lecture series. I'm pleased to introduce today's speaker, Dr. Robert Ostfeld. Dr. Ostfeld is the Director of Preventive Cardiology, the founder and director of the Cardiac Wellness Program at Montefiore Health System, and a professor of medicine at the Albert Einstein College of Medicine. Dr. Ostfeld received his Bachelor of Arts in the Biologic Basis of Behavior from the University of Pennsylvania, graduating summa cum laude in Phi Beta Kappa, and his Doctor of Medicine from Yale University School of Medicine. Dr. Ostfeld earned the Outstanding Full-Time Attending of the Year Award at Montefiore for excellence in teaching medical residents, received the Program Director's Award for dedicated service on behalf of the Montefiore Einstein Cardiology Fellowship, and was elected to the Leo M. Davidoff Society at Einstein for outstanding achievement in the teaching of medical students. Dr. Ostfeld's research focuses on cardiovascular disease prevention through lifestyle modification, and he has launched randomized control trials investigating the impact of dietary patterns on erectile function. The title of his talk is Dietary Approaches to Reduce Cardiovascular Disease Risk. Welcome, Dr. Ostfeld.
Well, thank you. It's a great honor to be with you all here today. I'm very grateful to the American Society for Preventive Cardiology for the opportunity to speak today, and thank you so much for that generous introduction. So we're going to be speaking about dietary approaches to reduce cardiovascular disease risk. These are my disclosures. So we're all very aware that cardiovascular disease is quite unfortunately common. About 2 heart attacks happen every minute in the United States. Cardiovascular disease is the #1 killer of adult men and adult women in the US. And women are about 6 to 7 times more likely to die from cardiovascular disease than they are from breast cancer. Now, clearly, you do not want either one, but it highlights the epidemiologic importance of cardiovascular disease for women. And it's, of course, cardiovascular disease, a very expensive disease process. But there is a great opportunity for us to bend the curve. And on a population level, about 90% of the risk for heart attack can be accounted for by the following 9 risk factors. And this is from the Inner Heart study. And I put an asterisk by the different items that are impacted or influenced by diet. So #1, consumption of fruits and vegetables. Abnormal lipids impacted by diet. Hypertension impacted by diet. Abdominal obesity impacted by diet. Diabetes impacted by diet. Psychosocial factors, it may very well be that diet impacts psychosocial factors, alcohol, and then smoking and regular physical activity. So you can even see from this, from a 500-foot view, that there is a great opportunity for us to bend the curve. So I thought it would be helpful to level set where we are in the US in terms of diet. And the NHANES database, the National Health and Nutrition Examination Survey database, is meant to be a representative sample of the US. And in this analysis of about 12,000 people, they created a diet score. And they looked at 5 elements. #1 is at least 4.5 servings of fruits and vegetables a day. At least 3.5 servings of whole grains a day, low sugar sweetened beverage consumption, low salt consumption, and fatty fish at least twice a week. So if you had 0 or 1 of those 5 factors, you had a poor diet. If you had 2 or 3 of those, it was intermediate, and 4 or 5 was considered ideal. So how are we doing as a society? Well, we're not doing well. Fully 75% of the US had a poor diet. 25% had intermediate diet, and 0.7% of the US had a, quote, ideal diet. This is a crisis. There's a giant gap between where we are and where we could be. We as a society do not make the healthy choice the easy choice. And people will scream and yell about the super greatest diet of all time ever. And in my opinion, and many others, that is a total distraction because we are so far away from where that is. It's critically important we begin to close this gap in every step in a healthful direction. Every step is critically important. So does it even matter Does it even really matter if we all adopt an ideal diet? Well, so in this analysis, they modeled that if everybody adopted an ideal dietary pattern for 1 year, just 1 year, cardiovascular event rates would fall by 42%. 1 year. Find me a medication that would do that in the chronic setting. So, but what do guidelines say in terms of diet? Well, the American College of Cardiology, American Heart Association recommends a diet emphasizing vegetables, fruits, legumes, nuts, whole grains, and fish to decrease cardiovascular disease risk factors. And what about the American Society for Preventive Cardiology? Well, it recommends a diet consisting predominantly of fruits, vegetables, legumes, nuts, seeds, plant protein, and fatty fish for the prevention of atherosclerotic cardiovascular disease. And under these umbrellas, a Mediterranean-style diet can fit, a DASH-style diet can fit, a plant-based diet can fit. And a common theme is that those are very plant predominant. So if we look at a Mediterranean-style diet, it emphasizes green leafy vegetables, whole grains, fruits, nuts, legumes, olive oil, fish, and seafood, with moderate consumption of poultry, eggs, and dairy, and limited intake of red meat and sweets. A DASH diet, or dietary approach to stop hypertension diet, of course, originally developed for hypertension, emphasizes fruits and vegetables, whole grains, low-fat or non-fat dairy, nuts and seeds, legumes, fish, and poultry, and limits fatty meats, sweets, sugar-sweetened beverages, salt, and full-fat dairy products in the DASH dietary pattern. And a plant-based diet includes smartly or minimally processed plant-based foods, tons of vegetables, fruits, whole grains, beans, lentils, tofu, yams, nuts, and seeds. And you can see a common theme among these diets is they're very plant-forward. And I thought, since we're more familiar with the DASH and Mediterranean-style diet in day-to-day clinical care, I wanted to highlight a case, just an anecdote, but a case that we saw in our clinic about the impact that a plant-based diet may be able to have. And this was a case of a gentleman. He was 60 at the time, and he was having chest discomfort, maybe on average, walking 1 to 3 blocks, and he went to go see his primary care doctor. And his primary care doctor got a stress test, which was positive. And this patient told that doctor that he didn't want to take any medications, wouldn't take an aspirin, and did not want any procedures. And of course, at the end of the day, an informed patient is the boss. So in that milieu, he came to see us. And so you can see he was a little overweight, body mass index a little high, his blood pressure was a little up, LDL cholesterol is high, and on average, he could walk about 1 to 3 blocks before getting chest discomfort. And he reiterated that he was not interested in medications, not a statin, procedures, anything like that. And so what we had left was lifestyle change. And so he started a plant-based diet, which is, of course, supported by the ACC and the American Society for Preventive Cardiology guidelines. And so we're going to circle back to him in a little while and see how he did. So we'll take an overview of the impact of diet on various cardiovascular health measures. So dietary approaches, their impact on cardiovascular health, cholesterol, inflammation, hypertension, weight, diabetes, novel risk factors in quality of life, and mortality. So this is a wonderful analysis from the CARDIA, or Coronary Artery Risk Developments in Young Adults database. This is 18 to 30-year-olds free of cardiovascular disease, and they looked at about 5,000 of them. And over the course of 32 years of follow-up, the highest versus lowest quintile of a plant-centered or more plant-predominant diet was associated with a 52% lower hazard of incident cardiovascular disease. And of course, when we're talking about eating more plant-based foods, whether it's under the umbrella of a Mediterranean diet or a DASH diet or a plant-based diet, we're talking healthful plant-based food. Now, you could eat sugar cookies all day and be plant-based, or you could eat kale all day and be plant-based. And clearly, there should be a difference. And this wonderful study by Dr. Satija highlights just that. And in this prospective cohort analysis with about 4.8 million person years of follow-up, Dr. Satija asked, if you eat a plant-based diet, is it healthful? Is it not? So this bluish line here, the more of a plant-based diet you ate, the better you did, the lower your hazard for coronary heart disease. But clearly the devil's in the details, because if you look at this red line here, this is a healthy plant-based diet, the kale group, or the minimally or smartly processed foods. And if you ate the healthy plant-based diet, you did even better. But this is an unhealthy plant-based diet up here, and the more you ate of that, the worse you did. So clearly the devil's in the details and aligned with all the different dietary patterns we just discussed. And carbs, or carb, is often thrown around as a four-letter word. And the devil's in the details there as well. Now, it's important to know that vegetables are carbs, fruits are carbs, whole grains are carbs, but so is highly processed white bread. But in this wonderful meta-analysis by Dr. Reynolds with 135 million person years of follow-up looking at whole grains, eating more whole grains was associated with less cardiovascular disease, associated with lower mortality, less diabetes, less cancer. So the devil is in the details and supports consumption of whole grains. What about fruit? In this wonderful, and its impact on cardiovascular disease. In this wonderful analysis by Dr. Du, with 450,000 people and 3.2 million person years of follow-up, Dr. Du asked, if you eat more fresh fruit, is it good? Is it not good? Well, it turns out it's good. If you eat more fresh fruit, that was associated with less cardiovascular death, fewer coronary events, less ischemic stroke, and less hemorrhagic stroke. So we touched on dietary approaches and cardiovascular health. What about cholesterol, inflammation, and hypertension? In this wonderful analysis by Dr. Jenkins and colleagues, they looked at a dietary comparison study of a dietary portfolio of cholesterol-lowering foods, which was a high-fiber plant-based diet with a statin in hypercholesterolemic patients. And so it was a smaller study, and they randomized 34 people, 3 4-week treatments in random order, and the control diet lowered LDL cholesterol about 8-9%. The statin arm lowered it by about 33%, and the portfolio diet lowered LDL cholesterol by about 30%. Now, which is quite impressive and similar. The statin arm was lovastatin 20 milligrams, I believe, and so very similar to that. And of course, it's not either or to help protect our patients. It's all of the above. So we, of course, can use a statin when necessary, and of course, would want to use a more healthful diet. And we know, of course, that LDL cholesterol promotes cardiovascular disease, and that oxidized LDL particles, when the LDL particle burrows across or goes across the endothelial cell into the wall of the artery, it can become oxidized, where it becomes particularly atherogenic. And that process in a test tube study of oxidizing LDL particles was more difficult in the serum from vegetarians than from omnivores in a small study out of Taiwan. So interesting and hypothesis generating. And of course, with CRP, inflammation promotes all aspects of atherosclerosis as well. And in a wonderful study called EVADE-CAD, they took 100 subjects with stable coronary disease and randomized them to the American Heart Association diet or to a plant-based diet. And after 8 weeks, CRP, high sensitivity CRP, a marker of inflammation, fell more on the plant-based diet than on the American Heart Association diet. What about hypertension? Of course, it is the silent killer. And when you're a 45-year-old adult in the US, your lifetime risk of developing high blood pressure is ballpark 90%. I mean, it's mind-blowing, but it doesn't have to be a fait accompli. And if you look at the C-A population which is an indigenous population from the jungles of Bolivia, and their diet is about 72% carbs, but truly whole grains, 14% animal protein, 14% fat. They're extremely active, but they have slightly higher levels of inflammation because of they don't wear shoes all the time, and they may get some cuts in their feet. But if you look at the 75 to 94-year-olds in a wonderful cross-sectional analysis out of Lancet, with about 700 of this population. But if you look at just the 75 to 94-year-olds, of which there were 48, 8% of them had hypertension. 8%, compared to about a 90% risk when you're a 45-year-old adult in the US. So it is not a fait accompli. And in the Cardia study that we discussed earlier, in this analysis of 4,300 subjects with 15 years of follow-up, the highest versus lowest quintile of plant-based nutrition consumption was associated with a 36% lower hazard of incident hypertension. And the DASH diet, or Dietary Approach to Stop Hypertension diet, a dietary pattern embraced by the American Society for Preventive Cardiology and the American College of Cardiology, can significantly lower blood pressure. And in a prospective cohort analysis of the nurses' health studies associated with improved outcomes long term. So we discussed how dietary approaches can positively impact cardiovascular health, can lower cholesterol, may make LDL particles possibly less likely to become oxidized, can reduce inflammation, can reduce incident hypertension. What about weight? What about weight? Well, in this wonderful analysis of the Seventh-day Adventist study, about 60,000 subjects, cross-sectional analysis, they were able to look at a lot of different dietary patterns: vegans, lacto-ovo-vegetarians, pesco-vegetarians, semi-vegetarians, non-vegetarians, and the only group with a normal BMI was the vegans. And in this wonderful randomized controlled trial by Dr. Turner McGreevy and colleagues, they randomized people for 6 months to a vegan, vegetarian, pesco-vegetarian, semi-vegetarian, and omnivorous diet. And the vegan diet was able to lower their weight by about 7.5%, and it was statistically significantly more over the course of the 6 months than the pesco-vegetarian, semi-vegetarian, and omnivorous, but not significantly more than the vegetarian dietary pattern. So we discussed dietary approaches, how they can reduce incident cardiovascular or improve cardiovascular health, may lower cholesterol, may lower inflammation, may reduce incident hypertension, is associated with lower weight. What about diabetes? How may dietary approaches impact diabetes? Well, in the same Seventh-day Adventist study, the group with different dietary patterns, same as before, that had the lowest percentage of diabetes was the vegans, the plant-based arm. And in this wonderful prospective cohort study, where they looked at plant-based dietary patterns and incidence of type 2 diabetes in US men and women from 3 prospective cohort studies with 4 million person years of follow-up, if looking at deciles, if you were in the highest decile of a healthy, kind of a smartly processed, a healthy plant-based diet arm, you had a 34% lower hazard of incident diabetes. And if you were in the highest decile compared to lowest of an unhealthy plant-based diet, you had a 16% increased hazard of diabetes. So the devil is indeed in the details. And in this wonderful small randomized controlled trial by Dr. Barnard's group, they took 99 people with type 2 diabetes and randomized them to a plant-based diet versus the American Diabetes Association diet for 22 weeks. And the group in the plant-based arm lost significantly more weight. Their LDL cholesterol fell significantly more. And looking at hemoglobin A1C, for the group with no medication changes, because some people that had to back off on meds as they lost weight and got healthier, the hemoglobin A1C fell significantly more in the plant-based arm versus the American Diabetes Association arm, but in an intention to treat analysis overall, Hemoglobin A1C fell numerically more in the plant-based arm, but not significantly more compared to the American Diabetes Association diet. And going back to Dr. Du's wonderful work out of China, where they asked if you eat more fresh fruit, is it helpful? Is it not helpful? Well, in this analysis, they asked if you eat more fresh fruit, does it impact incident diabetes? Well, here in 480,000 participants, consuming more fresh fruit is associated with lower incident diabetes. So I'm kind of getting tired of hearing about how fruit causes diabetes. And what about if you had diabetes at the get-go? Well, they had 30,000 people with diabetes at the get-go. And if you consumed more fresh fruit, it was associated with lower all-cause mortality, even if you had diabetes at the get-go. So we discussed how dietary approaches can impact cardiovascular health, is associated with lower cholesterol, lower inflammation, less hypertension. And by plant-based diets, I mean the Mediterranean-style diet, the DASH-type style diet, a plant-based diet, all falling under that plant-forward umbrella, associated with lower weight, less diabetes. What about novel risk factors and quality of life? Well, our genes. We can't necessarily change our genes. I mean, I guess with CRISPR technology we can, but we'll just put that to the side for the moment. In a very interesting analysis of subjects with early stage prostate cancer, in a observational cohort, they took about 30 of them and for about 3 months had them have a much healthier lifestyle, a healthier diet, regular exercise, psychosocial support, and they biopsied their prostate at the beginning and the end. And after 3 months of significant lifestyle change, many anti-cancer genes were upregulated in their expression, and many pro-cancer genes were downregulated in their expression. So we can't necessarily change our genes, but we can change which ones speak, perhaps, making the healthy ones speak more loudly and the unhealthy ones speak more softly. Pretty mind-blowing. And the gut microbiome, of course, we're early days here, but it does appear that a healthful, high-fiber dietary pattern, fiber found, of course, in plant-based foods, is associated with a more healthful gut microbiome, which has a numerous potentially beneficial effects on the body: anti-inflammatory, lower cholesterol, psychosocial, improved lower anxiety, truly a broad array of benefits. What about quality of life? Well, in this wonderful analysis, changes in plant-based diet quality and health-related quality of life in women, here an increase in a healthy plant-based diet index was associated with improvements in physical and mental health-related quality of life in women as based on the SF-36 score. So we talked about dietary approaches, how they having a more plant-forward diet can improve cardiovascular health, can lower cholesterol, inflammation, hypertension, is associated with lower weight, less diabetes, improving potentially novel risk factors, potentially improving quality of life. But what about mortality? Well, fruit and vegetable intake and mortality. In this wonderful analysis, they have results from 2 prospective cohort studies over here of US men and women, and a meta-analysis of 26 cohort studies over here. And in the 2 prospective cohorts of US men and women, 5 versus 2 servings a day of fruits and vegetables was associated with a 13% lower hazard of mortality. And when they looked at 26 cohort studies from, I believe, 29 different countries across the globe with about 1.9 million subjects, 5 versus 2 servings of fruits and vegetables a day was associated with the same 13% reduction in mortality, remarkably consistent across multiple populations across the globe. And of course, like we talked about, anyone's idea of perfection does not need to be the enemy of good. Every little bit counts. And in this wonderful analysis, this analysis by Dr. Song gets exactly to that question. And on this study, they ask, If you replace just 3% of your calories from animal-based protein with 3% of calories from plant-based protein, is it good? Is it not good? In this analysis, it was good. If you replace just 3% of your calories from processed red meat with 3% of calories from plant-based protein like lentils, beans, etc., it was associated with a 34% lower hazard of death. Unprocessed red meat in this cohort, 12% poultry in this cohort, 6% fish in this cohort, 6% eggs in this cohort, 19% dairy in this cohort, 8%. I realize, of course, some of these things are a little more controversial, but the general overall theme is consuming a dietary pattern that is more plant forward under the umbrella of a Mediterranean, a DASH, or plant-based diet is wholly consistent with guidelines and reducing cardiovascular risk. Circling back to our case, because the plant-based diet we may see a little less commonly in day-to-day practice. Our 60-year-old patient with chest pain, didn't want medications, procedures, went fully plant-based. Fast forward 3 months, you can see his body mass index normalized, his blood pressure fell, LDL fell quite a bit. He could walk about a mile and he would stop because of chest discomfort. Fast forward about a year, and his blood pressure was still good. His LDL cholesterol was good, and he could jog about 2 miles. And I bumped into him just before the pandemic. Sorry, my dog is just to my right. I bumped into him just before the pandemic, and he was jogging 4 miles, and he told me he stops because he gets bored. So these are nutrients in plants versus animal-based foods per 500 calories. And you have plant-based foods, which will equal parts tomatoes, spinach, lima bean, peas, and potatoes, versus animal-based foods, which will equal parts beef, pork, chicken, and whole milk. So if you look at cholesterol, the first row, you don't need to eat any. Your body makes all you need. Protein, oh my God, my muscles are going to fall apart tomorrow. Beta carotene, it's subtle. Dietary fiber, your constipation will go away. These nutrients lining up favorably under the plant-based group. So we talked about how dietary approaches, the Mediterranean style diet in general, the DASH diet, the plant-based diet is associated with lower cardiovascular health, improved cholesterol, inflammation, hypertension, lower weight, diabetes, novel risk factors, quality of life, and mortality. And it is, of course, important for me to mention with the Mediterranean style diet, there are multiple large randomized controlled trials in primary and secondary prevention. Of course, primary prevention with the PREDIMED study, where a Mediterranean style diet was either enriched with nuts or olive oil, was compared to a more traditional, say, they call it low fat, but really more Western style diet, was associated with improved cardiovascular outcomes. And in secondary prevention, the Lyon Mediterranean heart study and the CardioPrev trial also highlighted how consuming a Mediterranean style diet versus a more prudent or Westernish style diet was also associated with improved cardiovascular endpoints. Very powerful studies supporting the benefit of a Mediterranean style diet. So why in the world is there a picture of a globe in a talk by a cardiologist? Well, the circumference of the Earth is about 25,000 miles. And according to the George Washington University Cardiology webpage, which I looked at many years ago, we have about 60,000 miles of blood vessels in our bodies. Now, I didn't double check it myself. I just took their word for it. So it's no surprise that if we treat our blood vessels well with a healthy diet, a healthy lifestyle, we treat every square millimeter of our bodies well. And along those lines, there's something that I made up called the CALE scan. Now, we usually do CAT scans looking for something bad. Well, I thought, wouldn't it be interesting to do a scan looking for something good? And that's the CALE scan. And so the CALE scan are things that are associated with improving by consuming more healthful plant-based foods, all aligned with the Mediterranean and a DASH and a plant-based diet. So consuming more plant-based foods is associated with lower stroke, less coronary artery disease, less heart attack, less heart failure admissions, less obesity, more weight loss, lower blood pressure, lower cholesterol, associated with less diabetes, less inflammation, and improved sexual function in men and women, and also fewer cancers of a variety of types, among other things. And here are some references to support what I just mentioned. So this is a wonderful quote from Dr. Kim Williams, the past president of the American College of Cardiology. I recommend a plant-based diet because I know it's going to lower their blood pressure, improve their insulin sensitivity, and decrease their cholesterol. Now, this is my dog, Toshi, who happens to be right on the floor to my right now. And Toshi is here to remind me that, yes, a healthy diet is critically important, but of course, that is part of an overall larger healthy lifestyle. And this is Life's Essential 8 from the American Heart Association. And so as you see, the 8 are a healthy diet, regular exercise, and this subway car looking thing is lower glucose. This is lower weight, lower cholesterol, lower blood pressure, not smoking, and improved sleep, of course, avoiding or treating sleep apnea. So with exercise, I was in Las Vegas many years ago, and this is the Vegas Strip. And as you can see, nobody takes the stairs. We have a long way to go. And translating these healthful lifestyle, healthful diet themes into behavior on a day-to-day basis, I believe is, and many others, one of the great needs, great callings of our age. But that's okay, because a few years later, I went to the American College of Cardiology meeting for cardiologists, and you can see nobody was taking the stairs. I'm like, I can't believe this, and I had to take this picture. So thank you so much for the honor of being able to present today. And I really look forward to the question and answer session. Thank you.
Thank you again, Dr. Ostfeld, for such a wonderful talk. You know, in listening to you, I'm struck by how impressive that patient's response was, and truly their dedication to lifestyle change. You know, can you tell us about any other examples of patient responses that you've seen from adapting to a plant-based diet? And what kind of feedback do your patients tell you, you know, when they've committed to really hard but thoughtful changes like this?
Well, thank you for the question, and thank the American Society for Preventive Cardiology for having me here tonight, and for all of you for listening in tonight or possibly later. It's a great honor to be here with you all, and I'm so enthusiastic about the interest in this topic. We all know how incredibly important it is, and you know, how challenging behavior change can be for all of us. And if anybody has a secret sauce for that, please tell me. So some patient examples, you know, a handful come to mind. That patient we presented during the talk, that was really a terrific example, one that we saw very early on in our cardiac wellness program. We just recently published a case in the American Journal of Lifestyle Medicine about a patient who reversed his erectile dysfunction by going whole food plant-based. And he was about in his early 50s, and he had already been on a statin for quite a long time when we met him. And he had known coronary artery disease, and his, you know, the thyroid function, testosterone, those things were normal. And he wasn't on any medication that could cause ED, like a beta blocker. And so we really thought he had vasculogenic erectile dysfunction. And he went plant-based because he was concerned about his cardiac health. Erectile function wasn't even on his radar. But then fast forward a number of months, his erectile function started to improve. He wasn't on, you know, any of the PDE5 medications. And over the course of about 18 months, it wasn't overnight, but over the course of about 18 months, it's in the paper, I forget the time exactly, he went from moderate ED by the IIEF-5 score, the International Index of Erectile Function score, to completely normal erectile function. I think that's the first time that's ever been reported. And we were excited about it because, you know, it's something that sometimes could be a sensitive topic, but is one that could actually be quite, we thought, motivational to help people change behavior. So we really wanted to get that information out there. There was another kind of remarkable case that we saw. There was a gentleman who came in who was advised to have bypass surgery. And it was a very reasonable piece of advice, and we advised the same thing. But he didn't want to have it, and so we couldn't do it, because if he doesn't want to have it and we do it, that's assault, right? So we didn't do it, and he was on all the good meds, and so he changed his lifestyle. He went whole food, plant-based. Fast forward 3-4 months, his walking 1 to 2 blocks with chest discomfort was now walking up a flight of stairs. He could do stuff with his family. I mean, he wasn't, running half marathons, but he had a very solid quality of life and had improved a lot. But then about 3 months later, I get a call from the cath lab, and he's about to have bypass surgery. I'm like, what? And so I got on the phone with him. I'm like, what's going on? And he's like, well, doc, I kind of got back into the fried foods and the junk foods. And I'm like, all right, hang on a second. You want to have fried foods and junk food more than you do not want to have bypass surgery? And he said, yeah. I'm like, well, all right. All right, you're the boss, man. So that was kind of an interesting and very, relatively rapid turnaround and relatively rapid decompensation. We see any number of things: blood pressure fall, cholesterol fall. Typically, when people do this, something gets better that we weren't even thinking about, like the guy's erectile function, or like a skin issue, or a chronic ache or pain. So it's just unbelievably satisfying that you really have the opportunity to help improve people. I mean, they're doing the work, but to maybe help guide them improvements across multiple different disease processes. So it's really wonderful, but helping people get from here to there is often the challenge.
Yeah, well, thank you so much for those examples and sharing how you approach that with your patients. And this will touch on some of the questions that are coming through in the chat as well. But when we see patients, clinic visits feel shorter than ever, and it can be challenging for us to take a thorough diet history and then to provide appropriate counseling to our patients about diet. So, can you walk us through how you approach a clinic visit like that, both the diet history taking as well as counseling, and then any notes you make either for resources that you share or how we can meet patients both culturally and socioeconomically to adapt this type of diet or lifestyle changes, taking those into consideration.
Well, thank you. Terrific question. I'll try to hit on all of that, and if I get myself distracted, please redirect me. It's clearly a challenge, and one thing to keep in mind before starting is that you don't have to do it all in one visit. Rome wasn't built in a day, and the registered dietitians, RDs, are clearly our friends. And if there's one somewhere in your system that you can refer to who can help you with this, and you can work with and become aligned with in terms of the kinds of dietary changes you want people to make, that's another wonderful resource. But so when I see people in clinic, I'm time limited also, and I do the usual history, physical exam, medications, all of that. And we go through a typical medical plan. Maybe we'll start statin or this or that, and we have to get this test or that test, and then I will weave nutrition into every patient encounter. So I will basically say to people that one of the critically important ways that we're going to need to protect you is with lifestyle change. And having as healthful a diet as possible is a critical aspect of it. And the lifestyle change, we'll talk about maybe statins, blood pressure pills, all important, but I'll say the cornerstone of this is lifestyle change. And stuff you guys all already know. I will tell them quite literally, I've been a cardiologist now for over 20 years, and outside of a medical emergency, like someone gets shot and has to be put back together again, I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides. And then I will try to tie it into something, something specific about them. Do they want to lose weight for a reunion that's coming up? Do they have coronary disease? They want to, have less angina. Do they want to avoid a stent? Do they want to lower their cholesterol? Like there's something about them that I try to focus in on with what the diet can impact. And I go through how I want them to eat. In plant-based diet, I get into a little more detail. And I have a handout for people that I have 3 different levels of that, more or less plant-based. They're all pretty plant-based. And I'm saying, we don't need perfection to be the enemy of the good. Good, every little bit counts. And I have a checklist, and I have points. Like every serving of greens is a point. Every serving of fruit is a point. I try to gamify it a little bit. I want you to get 15 points every day. And I want you to write me on the MyChart portal once a week and tell me how many points you average. And I say, do you average 5 points a day, average 10 points a day? And I'm like, you don't have to get into decimal places. Be surprised, some people, well, decimal places. But so I'll do that. And we have these Saturday morning sessions that we do periodically. These are little extra that are about 2.5 hours long, where we take a deeper dive into the why and how of plant-based nutrition. So I'll speak for about an hour, a registered dietitian speaks for about an hour, and we have a half an hour for Q&A. We don't charge patients for it. And they're done virtually. We used to do them in person, but then the pandemic came and we just do them virtually now. And so there's that. And the main resource that I recommend for patients, this may sound a little odd, but there's but people want to be entertained, they don't want to read a book. I will direct people to the documentary film, The Game Changers. And that's all about the vegan athletes. The first question you often get for people who are new to the space is about protein, and I will direct them to that. And I look at it and look, you can get 1.5, I think it is, CME credits from the American College of Lifestyle Medicine, the last time I checked, for watching it. So, it's quite evidence driven. And I feel like it's a nice way to kind of reinforce in a much more entertaining way than I could ever do about eating and living this way. And they talk, about all kinds of aspects of the beneficial health impacts of a plant-based diet. And then I follow up with them over time. And I've had people give me the Heisman for like 3 years. And then they come back like 15 pounds lighter and blood pressure is much better. And like, what's going on? Like, well, I decided to do it. So, never lose hope. And every little bit counts.
Thank you. Implicit in that, again, was the concept that Rome isn't built in a day, and the partnership that you clearly have with your patients trying to partner on behavior change. Some questions are coming in, and I'm going to try to weave them together for us. We've got a bunch coming in about macros. How do you ensure adequate protein? How do you ensure, should we be doing 40, 30, 30 carb, et cetera, from like a macro standpoint? And then when you're counseling patients, do you focus on macros like that, or do you focus on where they're getting those macros more specifically?
It becomes a little more important, I find, on the inpatient setting, because sometimes people are really ill and they have some very acute needs, and we could dive into. We have an aspect of our program as an inpatient component as well. But in the outpatient setting, to be perfectly honest, I do not focus on macros at all. And I guess I should say 99% of the time. I mean, I don't want to never say never, but I don't focus on macros. I feel that it becomes a little, in my opinion, a little distractionary. People get focused on how much of this, that, like, it just overcomplicates things. And it's so hard already. Like we were talking about, Dr. Dudum and I earlier, that society does not make the healthy choice the easy choice. And the more we complicate it, I found, just the harder it is to do. So I don't focus on the macros, but I do give them a very detailed outline of like how I want them to eat. I want them to eat a varied plant-based diet with fruits, vegetables, whole grains, beans, lentils, chickpeas, peas, tofu, baked potatoes, salads, raw nuts, avocado, avoiding the junk food. And so when they do that, when they have a varied plant-based diet, and please eat until you're hungry. If you're hungry, eat more. I would get into it's not calorically dense, it's nutrient dense, so you may need to eat a little more. And so I really don't get into the macros, but I do get into having a varied plant-based diet. I do make a particular point to emphasize beans, lentils, tofu. Um, and I've never encountered anyone with a protein deficiency, and I have some patients who are, as I'm sure many of us who are quite athletic, and it's just not been an issue. And so, and if you think about the Western diet, like how often are people regimented? Like they'll have their maybe chicken sandwich at lunch and their I don't know, some steak thing at dinner and the Fruit Loops for breakfast, and same thing day after day. Like that is a narrow diet, as you all well know. Um, and so, and I found that with a plant-based diet, like I guess if someone ate romaine lettuce all day every day, something bad would happen, but I've never found anybody who does that. So I just don't focus on the macros. I focus on the varied plant-based diet, thinking that having all those nutrients is going to lead to a symphony of health, be obviously helpful for the microbiome, and lead to good outcomes, which we've seen for gosh, like a decade and a half. Now that I say that, it's like, oh my God, that's happened a decade and a half. But in the inpatient setting, when people are critically ill or really, really frail, we definitely get the RDs involved to help us with those very, very important aspects.
I love that. And it sounds like your main ethos is you want your patients to take away a handful of simple tools and simple, guides. You don't want them to focus on minutia of, it's got to be perfect, this macro or this, that. You just want them to make incremental change.
Yeah.
So thank you for that.
And one thing I'll do sometimes when I'm particularly strapped for time, I'll just say, okay, for now it'll be 2-2-2. And I'll do that weirdly. So they'll remember it. 2-2-2. 2 servings of greens, 2 servings of vegetables, 2 servings of fruit each day. 2-2-2. And if they even if they just did that would be amazing. I mean, you saw that stat in the beginning of the talk where 0.7% of the US has an optimal diet and 75% has a poor diet. I mean, we are so far away from where we need to be. So even if everybody did 2-2-2, that's a home run.
No, and I love that. And when we look at the NHANES data by age, we deviate from diet very early on. So something we can all think about. We've gotten a couple of questions related to what I'll term some of the extra stuff that we think about. So I want to think about are there when patients ask us, I'm short on time, are there recommendations like meal kits or services? How do you tie that in? And then when patients are concerned that, maybe they may not be getting enough of X and they want to know about supplements, or they might be overweight and have an FDA indication for GLP, how do you tie in all of those different things together for your patients?
There's one supplement that I pretty much always recommend, and that's vitamin B12. B12 is made by microbes in the soil, and now that we wash everything, there's no dirt on it, so there's no B12. Animals get it because they eat soil, or other animals that eat soil. But now that we're using so many pesticides, it's killing a lot of the microbes, and a lot of people who eat animal-based diets are B12 deficient anyway. So I check a B12 at baseline, and basically everyone, I see a lot of kind of low numbers. And I put everybody to start on 500 3 times a week, 500 micrograms 3 times a week, and then I'll change it over time depending on what they need. Every now and again, you pick up someone you're worried about pernicious anemia. And so that's one supplement I definitely do. I don't formally recommend any other supplement. I mean, if another doctor, like if they saw the endocrinologist and they're on vitamin D and calcium, like have at it. But I don't recommend specifically any other supplement. I don't think the data is strong. I don't think the guidelines support that, outside of hyper-specific situations like pregnancy or known deficiency or something like that. So so the guidelines, as far as I know, do not support that. We're actually just about to start to put together a clinical practice statement for the American Society for Preventive Cardiology about supplements, and we're beginning our discussions about how we're going to outline that. That's what I do with supplements. In terms of the medications, I think you mentioned the GLP-1 type medications. It's of course all of the above to protect someone, whether lifestyle, medications, procedures when necessary. Obviously, it's not either or. Now, the informed patient is the boss, and that case example that I talked about during the talk about the guy whose angina went away and gets bored when he jogs. I had the opportunity to present that case at the ACC many years ago, and cardiologists they get up and you ask questions, they were like, a couple of people were like mad at me for not making him take a statin. I'm like, I can't make, what do you want me to do, wrestle him? Like, I can't. But at any rate, it's all of the above, of course, to protect people. And so when the data for the GLP-1s, it's really excellent. And we're just scratching the surface of, the benefits that it can have, cardiometabolically, even apparently even before weight loss. So if someone meets the criteria for it, you have a risk benefit discussion, you talk about the potential side effects, particularly the nausea, GI side effects. But I definitely use them. And I find that my patients who are, eating more of a, high fiber plant-based diet have way fewer GI side effects, less nausea, less feeling kind of nauseated. But those eating a more typical Western diet, this is just my anecdotal experience, will have more of that nausea kind of feeling. So I definitely use that in addition, for the people who meet the criteria. And in terms of the prepared meals, I haven't thought about that. There are definitely services. If you go online, there's a whole bunch. I haven't thought about that recently. I should think about that again. In parts of New York City where I live, it's not very hard to order meals, and there's supermarkets around, but there are also food deserts, and that's a real problem. Some parts of New York City, it is harder to access healthful foods. And in clinic, I'll almost never talk about organic because it's cost prohibitive. I don't think there's a lot of great randomized controlled trial data about the additional benefit of it. I mean, it makes an intellectual, like a emotionally compelling story, but the evidence behind it, I don't know if is quite as strong. But at any rate, so I don't even talk about that because it's cost prohibitive. And you can buy things in bulk. If you're able to get to a Costco, or you can get or something like that, a giant sack of beans, a sack of brown rice, a sack of oats, some sauces, frozen fruit, probably even more healthful than fresh fruit because frozen at the peak of freshness, frozen vegetables, and that can be a lot of meals. And there are programs within the Montefiore system to try to help people access more healthful foods, whether it's relationships with bodegas or a farmer's market over the summer, things like that. We even created plant-based meals that we have for our inpatients and that are also served in our cafeterias for staff or visitors as well. So it's a hurdle, but people are working to chip away at it. So I haven't thought about those meals, but there's so many online that you can order that are plant-based.
Yeah, I appreciate you touching on many things, including something that has come up in a couple of your answers, but it's, how do we meet patients where they are, where they're coming from, what works budget-wise, et cetera. And again, not letting perfect be the enemy of the good and trying to equip our patients on this journey. We're close to time. A handful of questions have come up related to, objective markers and how do you navigate the perception that medicines can be a quick fix, but putting in long-term, similar to what we were talking about, changing diet, changing lifestyle is one of the hardest things that people have to do. They're making, thousands of decisions in a week about what they eat and where they go. And So how do you, part one, help them on that journey in addition to therapy to do the hard work? And then do you use any objective markers, things like CIMT or lipid panels to talk and track progress for your patients about, how they're doing?
Yeah, I mean, I don't mean to be glib, but I'll try whatever I can that's reasonable to try to help people change their behavior. And so in terms of just the diet aspect, I try to come at it from a bunch of different angles. That personal one of like, what specifically are they want to improve their complexion, improve their erectile function, they want to lower their LDL, whatever it is, talk about it, the thing that's important to them. And we have the handout with the checklist and the points, and I ask them to write me on the portal once a week, so they're constantly engaging with it. Then I try to reinforce it. We're limited with time with the Game Changers documentary. I mean, it's just another touch point. With our Saturday morning session, that's another touch point. And that one, I encourage them to bring a friend, a family member, or whatever, to watch it with them, so their local community can, maybe begin to change with them, because that's an important aspect of it. I've had some pretty split families, which can make it be kind of challenging when one person wants to do X, but the other people want to do Y. And so those are, and then you follow up with them over time. Sometimes I'll see people, and from a billing perspective, this can be helpful. Like, I haven't done this in a little while, but every 6 weeks or so, you can have them in just for a blood pressure check. And it can be just a 5-minute quick visit, touch base, how are you doing with the diet? Just like rah, check their blood pressure, and then, have them go. And that can be a very, very quick visit, which you can bill for. So in terms of metrics, this is sort of a metric. The thing that I hear the quickest is that people feel lightheaded or dizzy. Maybe if they really go all in 2 weeks out, they're a little lightheaded. And what's going on? It's basically we're making them healthier, and we need to peel off blood pressure medications. I see that happens not uncommonly. Then things like, you don't check cholesterol in 2 weeks, right? Then I'll see like cholesterol. So the things that I'll check their blood pressure, can follow their weight, their symptom, whatever, their angina, their whatever, that can start to improve pretty quickly. It doesn't turn around all the way right away, but that can improve pretty quickly. I definitely follow cholesterol, but just the standard lipid panel. Like, I don't go beyond that. I don't think that's aligned with guidelines. So yeah, so I don't really get too fancy with the extra testing. I don't follow CIMT. I don't follow plaque volume. Every now and again, you may have an outlier patient like that. But for the most part, lipids, symptoms, blood pressure, weight, the usual stuff that we would get every day.
Great. I think we only have a space for some rapid fire type things. Is there any data related to comparing strictly vegan diet to a Mediterranean diet or Mediterranean diet with fish that we can look to?
Yes. Barnard's randomized controlled trial looking at a plant-based diet versus a Mediterranean-style diet. Neil Barnard's group out of Physicians Committee for Responsible Medicine. And there, most of the metrics improved more with a plant-based diet compared to a Mediterranean-style diet, except blood pressure did do better with a Mediterranean-style diet. I don't remember all the metrics, but it would be Barnard, Mediterranean versus plant-based, won't be hard to find. There's a green Mediterranean-style diet study, which is looking at fatty liver mazzled. And it was a kind of a, maybe, it was 3 arms, a healthy diet versus a Mediterranean diet versus a green Mediterranean diet, so much more plant-based. And it was with MRI, and it was randomized. And the green diet, the green Mediterranean diet arm did significantly better through a number of metrics. The primary outcome, I think, was the liver MRI finding, and that improved the most on the green Mediterranean style diet. So those are randomized trials looking at that head-to-head. And there are some post-hoc analyses. I mean, Mediterranean style diet is great. Don't get me wrong. It's excellent. There is a post-hoc analysis of PREDIMED, the primary prevention study of Mediterranean style diet, which Mediterranean style diet did better than a more typical Western diet. But a post-hoc analysis, if you went more plant-based, they had like quintiles, I think. The highest versus lowest quintile of a plant-based diet under the umbrella of a Mediterranean style diet had like a 52% lower hazard of death, something like that. I think it was like 2013 or something. It wouldn't be all that hard. It's post hoc analysis, plant-based PREDIMED. It won't be all that hard to find. And there are other studies like that. There's the Greek Mediterranean style. It was part of the EPIC cohort. There's a Greek arm with like 20,000 people. And as I recall, more plant-based did better in that prospective cohort study. And that they of course have more of a Mediterranean style diet there, but those are the two randomized trials that I can think of off the top of my head.
Wonderful. Well, Dr. Ostfeld, we are at time. I want to first thank the ASPC for a wonderful CardioCore lecture series. I want to thank you for really such a wonderful talk and Q&A session with everything that you were able to highlight for us, and thank all the attendees for joining us here today for the CardioCore lecture. Thank you, Dr. Ostfeld.
Thank you all so much for having me, and we're all in it together trying to bend this health curve. So thank you.
Thank you.